Welcome to my presentation on how we are using AI to identify suspicious regions in lumpectomy margins using optical coherence tomography. There is a critical unmet need in breast conservation surgery. Currently, between 20 and 30% of breast lumpectomy procedures require a second visit for re-excision of positive or malignant margins. Intraoperative evaluation of breast lumpectomy specimens using wide-field OCT may aid in visualizing these microstructures to help achieve clear margins at the time of primary surgery and improve patient outcomes. This presentation will go how we have leveraged AI methods to correctly identify these suspicious features in OCT images. So, what is OCT? Optical coherence tomography is the optical analogy of high-frequency ultrasound and produces real-time, high-resolution images that are 10 to 100 times higher than ultrasound or MRI, with tissue penetration depths of up to 2 millimeters, perfect for assessing lumpectomy margins. For this study, we look to combine this advanced imaging technique with computer vision and deep learning. We have developed a convolutional neural network algorithm that performs binary classification of wide-field OCT images into suspicious and non-suspicious classes. We use image data which was collected, analyzed, labeled, and validated with a high concordance to permanent pathology by subject matter experts and clinicians. The goal of this deep learning model was to be both accurate and computationally efficient to integrate into a surgical workflow and feasibly and effortlessly fit inside the cold ischemic window. This model includes 3 convolutional layers with downsampled 32 pixel patches as inputs and with a weighted loss function which was trained and validated on over 200,000 regions of interest. These included DCIS, or ductal carcinoma in situ, and invasive carcinoma, as well as well-known mimickers. So how did it go? We tested our model on over 1.9 million OCT regions of interest and identified just over 100,000 regions as suspicious, with 384 of those correctly identified as malignant, yielding a 70% true positive and 5.2% false positive detection rate, with sensitivity and specificity at 70% and 96% respectively. All images were classified in under 20 minutes, with this number of images equivalent to 25 patients or about 48 seconds per patient, and this includes all 6 margins. These findings indicate the utility of applying a computationally light CNN for screening OCT images for evaluating the status of breast cancer lumpectomy margins immediately following resection. This study, with a model tuned to real-world clinical application, demonstrated that it is feasible to accurately identify regions of suspicious DCIS or IDC in breast lumpectomy specimens to aid in improving surgical outcomes and reducing re-excision rates in breast conservation procedures. To conclude, this study utilized wide-field OCT images taken at a time of resection and applied a CNN model to reduce suspicious ROIs by 95% in clinically relevant timeframe. This model is currently being evaluated in a pivotal study which looks to reduce the number of re-excision in breast conservation surgery in real time. Thanks again for listening to my presentation.